I'm Joe Chilling, mornings from 7 to 9 on Buffalo's oldie station, The Big Wack. Joining us on The Big Wack Buffalo on the Rise today is Jonathan McDonnell from BAM Acupuncture. And Jonathan, we should mention Buffalo Advanced Medical Acupuncture.
Exactly.
I don't say that all the time. Let's talk about who listening, who viewing out there can actually use your services, do you think?
Yeah, absolutely. So, I mean, obviously we're an acupuncture and integrative medicine clinic. The patients that we tend to help or that tend to gravitate to us, we really thrive on the complex cases. So patients that come to see us tend to have exhausted all conventional treatments. People that are kind of losing hope, Often I'll have patients come in and they'll sit down and they're like, I don't know if you can help me. I'm here just as my last resort. I've been told I just have to learn to live with this. So I would say in general, if you've been told there's nothing we can do for you, you just have to learn to live with this, you should make an appointment and come see us, because often that's not the case.
When you start thinking about age, when I hear you say someone comes in and says, this is a last resort, it automatically makes me think of somebody older. Is your clientele generally older, or is it all ages?
All ages. I mean, last year we had our youngest patient, I think she was 12.
Really?
Yeah, I mean, that is definitely more the exception than the rule. I mean, you don't tend to get neurological problems at 12 very often. But yeah, I do think our patients do tend to be older. Reason being is these chronic diseases, when they start, usually it's not a problem, right? You can manage it, you can just keep plugging along, work your way through it. But eventually these chronic problems do catch up with us, and that's, if we're fortunate enough to live long enough, that's when it happens.
It would make me think, this is a generalization now, that your clients are more male than female, because I would think that males have a tendency of saying, I'm just going to wait, and a female is much more attentive, if you will, to their health, I think, than some of us guys.
That's true. I mean, when I think it's a pretty even split between men and women. What I would say is it's a different motivation. The men that come to see me, it's more like, I want to get back on the golf course or that kind of thing. Women, it's more, I'm having pain and I don't want to deal with it. Men, it's really got to limit your manliness, I think, a little bit before you actually do something about it. Where women, yeah, they're definitely more proactive.
So what do you think, I mean, I know this is going to be a difficult question, but what do you think is the most common thing that you treat?
Oh, hands down, peripheral neuropathy.
And explain what that is.
Well, there's a lot of different forms and varieties of peripheral neuropathy. It's kind of a very broad term. But anytime you have dysfunction of the nerves in your arms or legs in the peripheral, we classify that as, or Western medicine classifies that as peripheral neuropathy. And there's different, manifestations of that too. We see a lot of chemotherapy-induced neuropathy. One of our patients, Phil, unfortunately, as he got older, he developed non-Hodgkin's lymphoma. Battle of his life, and he won, but he was left with numb hands and feet, couldn't feel his hands and feet. So he came in for treatment with the motivation that he really, he's a woodworker. He wanted to help his grandchildren, and teach them how to do these things. But he was finding that he was dropping the tools and he couldn't find the screws and that kind of thing. So he came in for treatment. One of the things about chemotherapy-induced neuropathy, once that drug is gone, we can alter the course of the nerve, the health of the nerve, and he's back to 100%.
What about, and I see this maybe with, with older people, friends of mine or something like that, that will say, I'm warm, but my feet are really cold. Mm-hmm. My hands, are really cold. Is that something that should be a warning sign for them, or something they should get treatment for?
Sometimes. I would definitely get that checked out. There's a lot of different things that can cause that. And I really can't think of any of those causes that we don't have a good solution for, honestly. And we do, I will get people Raynaud's syndrome is something I think of when you say that, and that's an autoimmune condition where the blood vessels just constrict excessively when you're exposed to cold. That's something I've been treating for years, and that you kind of run the gambit. That sometimes can hit younger people, sometimes older people. But that doesn't necessarily mean that's what's going on. That can definitely be a symptom of neuropathy. But the thing when you're treating something like a chronic disease like neuropathy, it is a progressive disease, right? So if you start noticing these symptoms, you come in for treatment right away, usually, that means better outcome, and that means faster results. So yeah, if you're more proactive and you're noticing hey, something is different here, I would encourage you definitely to get it checked out.
Except, when I walk, I'm out in the cold. I'll start to feel, like my fingertips might feel cold or something like that. But does your body kind of draw that heat into a center area?
Yeah, I mean, that is a normal response, right? That's your body trying to conserve heat, constricting the blood vessels. But in some people, that response is exaggerated. And that's when we say that's more of like a neurological autoimmune type of condition, like your Raynaud's. That can also be an indicator of, just the circulation in general in your hands isn't what it should be. So yeah, it is normal. And what I would say is normal is like, when you go out, your hands should get a little cold, maybe a little numb, but as soon as you get back into a warm condition, that should come back. If it doesn't, then that's something definitely you should get checked out as well.
And type 2 diabetes, can that cause some of these things?
So that's another cause of neuropathy, and that is chemotherapy and diabetic types of neuropathy are definitely the two most common types of neuropathy that we see in the office. And there's a lot we can do for patients with diabetes as well.
So first thing, they should give you a call, right?
Yeah.
Right off the bat, not feel, inhibited or anything like that. You're not going to look down at them.
No.
You're going to give them some solutions to their problems.
Yeah,
right?
if you think you are a hot mess, don't be shy. We specialize in hot messes. And I say that in the most loving way. Like, people do come in and they're just, I'm just a hot mess. I don't know if you can help me.
Yeah.
But we're not going to look down on you. It's very simple. First step, call our office at 716-632-2207. You're going to talk to one of our patient care coordinators, set up that consultation, and then you'll sit down with me, and then that's when we'll do the detective work. We'll figure out exactly what's going on. If it's something I can help you with, I'll spell out a really clear treatment plan from beginning to end. There won't be any surprises. You'll know what to expect.
Well, Jonathan McDonnell, if he calls you a hot mess, you know he loves you. For more information and answers to your questions, contact Buffalo Advanced Medical Acupuncture by calling 716-632-2207 or go to bamacupuncture.com. Sponsorship and promotional consideration for the preceding segment was provided by Buffalo Advanced Medical Acupuncture. And join me from 7 to 9 a.m. weekday mornings on The Big Whack.